most of Nigeria's labor force businesses are informal. So you have about 60% of the economy is informal. And so, like, where do you even start to try to get people to pay for insurance?
Dr. Ikpeme Neto.
That's our guest today on Noble Conversations.
The noblest.
This is a good one.
Yeah, I think so as well, bro.
This is a good one.
This is the guy.
The guy
Yeah.
when it comes to digital health in Nigeria.
Yeah.
The guy.
I want to see about it. Now, I heard he went to, based off what I know, he went to medical school in Ireland.
Yes.
That's where he went to medical school at.
Yes.
And I'm not, from what I've heard from other people who have also gone to like medical school in like Europe, they've had very unique experiences. So I really do want to touch on that.
I'm curious to see what his journey was like to even get into Ireland.
Yeah.
And then doing medical school in Ireland, right? And even going back to Nigeria, because he's, you know, from what I've seen, like he started a company called Wella Health, which is basically almost like a health financing, health insurance.
I'm also interested to like, how did that like go about? Like going from like being like medical school, you know, physician and all that stuff, to digital health, you know,
like the business side of healthcare.
Yeah, because that's something I'm personally very interested in as well. You know, that's something that I also want to.
Dr. Obonaya.
Hey, it will happen. It will happen. It will happen. It will happen.
Glory.
Yeah. But hey, man, I don't know. That's the heart of an entrepreneur right there, bro. To jump in uncharted waters.
Yeah.
And actually go do that stuff was crazy.
Yeah.
It seems crazy. But
I mean, I think it paid off too because, like, I mean, Africa Business Heroes. So for those who don't know, Africa Business Heroes is almost like a business like case competition that Jack Ma, who's a Chinese billionaire, started. Basically, I think he committed 100 million over 10 years to fund startups in Africa. And so Dr. Neto.
Yeah.
Right. I think he won the first place for 300,000.
Yeah, he did. He did.
First place. And this is huge. This is not,
that's not small money.
Because it's not. And I mean, that just goes to show the hard work that he's put in over the years.
And not just the hard work, but the impact.
Right. And I mean, the company, so this is something that I learned, you know, because I did some work with almost like a venture capital group in college. And one of the things relax. Calm down. I'm not
venture capital.
Not like that. Not yet, but soon, amen.
Yeah.
But one of the things that they tell us is the company, like when you're evaluating a company, yes, you look at their financials. Yes, you look at their profit, like how profitable is the company, how, you know, to see whether or not to invest. But one of the biggest things, actually two of the biggest things that they emphasize when evaluating whether or not to give a company money is the founder. Like the first thing is the founder. How tenacious is the founder? How, you know, what's their track record? What level of like how committed are they to the business, right? And then the second one, and I think those are things you can find out by just talking to the person. Yeah. The second one is, what does your team look like? And it seems like Dr. Ikpeme Neto has two of those things. Yeah. I mean, he has the grit.
Yeah. Right? I mean, bro made it through medical school. Bro's a practicing physician. It takes some grit to do that, period.
Oh yeah.
But to actually go out there and start something, whereas nothing like that has ever been started before. I think that takes a lot of tenacity. It takes a lot of gusto. You know what I'm saying? Like guts, you know. So yeah. I mean, we're just gonna have some conversation. You know
I mean, noble conversation.
Noble conversation. Hey,
if there's anybody that you need to go to for digital health in Nigeria, it's Dr. Neto.
Wow.
See,
if there's anybody,
lots of people say that, and it puts me in a tight spot because people come with these high expectations. I'm like, I don't know, man. You know, I'm just trying to figure it out.
Yeah. You know? I mean, you've done a fair share of figuring it out. You know, basically from what I can tell. So tell us about yourself. You know, like where did this all start? You know.
Yeah, that's always a tough question to answer because, you know, where's the best place to start? I would say with regards to digital health in particular, I mean, I trained as a doctor, so always wanted to help people. I mean, I was kind of the cliche kid who wanted to help people, right? And so went to med school, and then, was going through the motions of training to be a doctor, but I was never quite sure what specialty to do. I knew what I didn't like. I didn't like early mornings. So surgery was out of the question for me. So I was like, I'm not getting up at like 4 a.m. Like, no, nobody should do that. And so for me, it was
But this one, you're staying up till midnight.
Well, yeah. Exactly, right? Yeah. And I get up even earlier now these days. But I wasn't keen on kind of surgery because of that. And I was trying to figure out, what to do. But then I kind of became enamored with the idea of having impact on a large scale. And so I wanted to look back after my career and have had impact on lots of people. So in the magnitude of, hundreds of thousands, potentially millions. And I kind of figured that, sitting in a clinic day to day wouldn't enable me have that sort of impact. And so while I, like the clinical stuff, so that seeing patients, being in a hospital or in a clinic, it felt like I could do more and I could impact more people. And so I kind of flirted then with the idea. So the traditional way that doctors think of having impact on a large scale is via public health. So when I used to tell this story prior to COVID, people were like, what's that? Nobody knew what public health doctors did. That has changed.
Everybody knows.
Everybody knows now, But when I, contemplated it, like, it wasn't glamorous. It still isn't glamorous, but I think COVID certainly made it more apparent that, public health doctors are super important. But when I considered it, I thought, okay, this is a great specialty to make impact on a large scale. And so I started to kind of pursue it. But the more I did it, the more I realized that perhaps it wasn't for me, simply because there was a lot of talk and not a lot of action.
Okay.
And so
in what sense? Can you expand on that?
Yeah, so public health is really around policy. So it's around influencing policy. And what you find a lot of times is that the work to get sort of policy to change is really arduous, takes a lot of time, effort, and energy, and you may not even have the resources. So across your career as a public health doctor, it can be fairly difficult. Other than, so there's the bog standard public health stuff of, say, chasing infections and stuff like that. I didn't want to do that. I wanted to do like exciting stuff. Because I went to medical school in Ireland, and part of the effort, and sometimes you don't see a lot of results straight away. And so that's what I kind of ended up learning. And so I was like, I don't know if public health is for me. Let me keep kind of figuring it out. So I was training as a hospital doctor, working in internal medicine, still trying to actually go into public health, maybe do a bit of healthcare management. So I ended up doing a course in healthcare management. And so I say all of this to set the scene as when then I started to, all of this was going on in my mind. I had the healthcare management, training, public health, looking at, populations and, big impact. Then I started to help my mom figure out healthcare in Nigeria. At the time, I was working in New Zealand. And I figured I was, far away. I was using the internet and technology to, do stuff for her. So find doctors, keep records, give advice, that kind of thing. And this was
quick question.
Go for it.
What did your mom do? What do you mean you were helping your mom? You said you started off helping your mom. What was your mother?
Yeah, no, with her own symptoms. So she was navigating so she was having all these symptoms that weren't straightforward and kind of nobody could really diagnose appropriately. And so just helping her navigate the healthcare system. So going to the right doctors, recording stuff, getting the right tests, all of that. And I was, miles and miles away in New Zealand. And I figured, if I can do this for her, perhaps I can do this for way more people. And then I can have that impact on a large scale. And I figured that, considering how bad it is in Nigeria and Africa, where lots of doctors and healthcare professionals are leaving, that realistically, technology is the only way you're ever going to get healthcare to where we need it to be. And so I was like, okay, healthcare, health technology, digital health, that's the way to go.
Okay. And so Nigeria to Ireland to New Zealand, what was that story? What was that journey? Why Ireland?
Yeah. So Ireland is simply because of a newspaper. So I say be careful what newspaper you read.
Okay.
Because it can change your life
Which
significantly.
newspaper?
It was The Guardian. It was the Guardian in Nigeria.
The
Yeah.
Guardian.
So there was an ad in the newspaper that said, "Come study medicine in Ireland." And my dad was like, "Yeah, why not? Try it out." So that was it. So we went to the information session. My dad was like, "Okay, this looks interesting." Admission in Nigeria was slow, and he's like, "You know what? It's probably better off going to Europe anyway." So yeah, that's how that came about.
Okay.
Yeah.
I feel like a lot of Nigerians and just Africans in general. I feel like a lot of people go to Europe for education when it comes to medicine. I mean, arguably so. I mean, I think it's reasonably so. Based off what I've heard, I'm not gonna lie, like they pretty much have it going on in regards to medicine.
Yeah, so I mean,
and I also know that it's also affordable as well.
Yeah, so I mean, compared to the US, certainly yes. Depending where you go to in Europe. So if you go to Eastern Europe, so Hungary, Poland, Romania, lots of Nigerians go there. Ireland, not so much, but a lot of Americans and Canadians, come to Ireland to study. And in my class, we had loads of Americans. And so what happens is, lots of people then go to the US for postgrad. So they do the USMLEs and they end up in postgrad positions in the US.
What part of Nigeria did you grow up in?
So I grew up in Abuja. I was born in Lagos, but grew up in Abuja. So I went to secondary school in Abuja.
Was it boarding school?
So I did federal government college for 2 years. That was boarding school. That was traumatic. It was total disaster. So I go by my last name, Neto. And part of the reason for that was when I went to boarding school, my parents, plastered my name on everything I owned. So my clothes, my buckets, like everything I owned. And I proceeded to lose everything I owned. And so my name was just everywhere because you see my clothes everywhere, my name on them, buckets, everything. So yeah, it was just easy to call me Neto, and the name kind of, the fame grew based off my stuff being lost.
Oh wow!
Yeah.
So that's socks, buckets,
everything,
clothes,
everything. And so yeah, so those 2 years were a disaster. So in JS3, my parents were like, okay, you need to leave, and then I ended up in a model secondary school in Maitama in Abuja. How
was that different from federal government college?
It was a lot less strict and stringent, so I would say my recollection isn't great, probably because of all the trauma, but I remember it just being a lot more relaxed in model, where it was a day school. It was also in a relatively well-off area in Abuja, and so we had kind of, I'd say, middle class, upper middle class kids. And back then, there weren't a lot of good private schools. So people like, upper middle class people still sent their kids to public school. And so like in my class, we had people that were of reasonable means, public servants mostly, that was reasonable means, but just there weren't many options. At least in Abuja, and we'd send your kid to a good private school. So we had just all ended up there.
So I would like to ask, based off of what I've heard about you, I mean, you're fairly accomplished. You've done a lot. Where did that drive start? With what first program or initiative, did that start with? And is that something that started in primary school or even at boarding school? Or even in college? Where did you first start to exhibit those traits of you being driven and actually doing things?
Being the guy that we go to for digital health.
Yeah, being Dr. Neto. I mean, I know it didn't. You said the fame grew with your stuff getting stolen. You know what I'm saying? But where did that actually start to grow?
Oh, I'd say it was after secondary school. Actually, funny enough. So I was So I finished secondary school fairly young. I think that was half the problem. There's all this research that says, boys mature slower than girls and are just not able to kind of concentrate, especially in school, up until their kind of later teens. And that was certainly true for me. So while I was certainly above average intelligence, I just didn't have the temperament, to kind of sit down and study and actually work hard. And so I finished secondary school when I was 15, but my grades weren't great. My WAEC result, if you look at it, is wow, is it this guy really? And even so, it's a funny story. When I was about,
I can relate.
I think a lot of us can relate.
Grades are not.
But I think it's a male thing. I mean, I can think of. I mean, I did A levels after that, but I can think of people that a few of my friends were terrible at A levels, but currently, like I can think of one guy. He's got a PhD in engineering, works for this massive big, engineering company. Like he's doing amazing. But when he was like 17, he was an idiot. You know what I mean? Just totally foolish. But like, that's
you don't know anything.
No, but that's how guys are. Unfortunately, we just kind of blossom a little later. But here's how unserious I was. When I was 7, my parents would drop me off at school, and thinking they had a responsible son, they wouldn't make sure I ended up in my class. They dropped me off at the gate and they would leave. And I would go round the back gate and walk back home, because home wasn't that far off, to go watch Ninja Turtles.
That's crazy. The school they're paying for.
Yes.
TMNT.
Yes. And so one day my class teacher is like, Mama Neto, Papa Neto, your son is not coming to school. What's going on? And they're like, huh? They're like, what? So there you go, that's like, my early days I was just not serious at all. I just wanted to play football, watch TV. Like I just used to spend all my time watching football and cricket. I love cricket. So I just used to like watch a lot of cricket, because, cricket lasts for 5 days. So I just would spend days watching cricket. So yeah, it wasn't until I'd say when I was sort of 17-ish, I went to A-level school and then, started to be a little bit more driven.
What switched? Like what changed?
I think, looking back, I think I just grew up, Okay. I just grew up. I don't think anything amazing happened, but I just grew up. I was just like, listen, man, like grow up,
Would you say that, was there anyone speaking into at that age? Like, did you have people that you looked up to or that were around you that it had some type of influence on you?
Not necessarily, not
maybe from a
specifically.
distance.
Yeah, no, I don't think anything specifically changed, Like, I mean, of course, my parents were there, and being encouraging, I was, religious and going to church. So I was a good kid, don't get me wrong. I wasn't doing anything mad or me. I was just playful. I just loved football. I loved doing stuff that was fun. I just didn't think spending. So actually, I was overconfident. I was like, oh yeah, 2 minutes of study. I was like, this is easy. Like, I don't need to study anymore.
No, actually, that's how it goes. That's the trap. That's the trap.
Yeah.
That's the trap.
So I did it. So, but then, like I said, when I got to 16, 17, I was like, okay, yeah. So I think I spent like 2 years at home. So I did JAM. I couldn't get in. So in that time, I spent a lot of time going to church, reading the Bible a lot. I spent a lot of time then, learning to play instruments. I learned the keyboard. Spent a lot of time learning music. So I, learned music. I know a bit of music theory. So I think that process just kind of matured me. I didn't have the pressure of school per se. And I kind of read a fair bit as well. And I guess my parents always on my back were like, why are you at home? Because you're useless and lazy, So yeah. I think all of that combined and I just grew up really. And then when I got to A-level school, I was like, okay, because my dad then was like, listen, I'm paying a lot of money for you to go to this school. You better sit up. I got there, I was like, okay, you know what? I better sit up. So yeah, I just did.
Was that when you started thinking medicine?
Well, I always wanted to do medicine. I just didn't follow it up with the right behaviors. I always wanted to be a doctor, but I was just not serious enough, really. Yeah.
So what's the, because all of that, like all the things you were doing during those 2 years, and all the perspective shifts that you were having during that time, almost are translated to the work that you do and how you view the work that you do, and doing it so that you're doing it first for God but also for other people. So how did all of that lead to digital health? Like, what was the origin of digital health? What's the origin story?
Oh, of the group? So Digital Health Nigeria?
Yeah, Digital Health Nigeria specifically.
Yeah, so when I returned to start the company, so I returned to Nigeria, said, okay, I'm going to build a digital health company. It was so difficult. And this was sort of 2015 when nobody was doing it. Like now it's cool to say, oh, I'm going to go do tech. I'm going to do a startup. I'm going to do health tech, whatever.
Yeah.
Back then, it wasn't cool at all. So, well, not so much that it wasn't cool. Yeah, it wasn't cool, but there wasn't any resource, like there was nothing. There was like nothing, And so I was going through a really, really hard time. Like when I say really, really hard time, I was really going through it. And I was having all this siloed and separate conversations with people in the space at the time. There was only a handful of people. And I'd reach out to them and I'd have conversations with them. I'd be like, CEO, man, I'm seeing really, really difficult things out there. How are you navigating it? What are you thinking? And so I'd have all these conversations separately. And I thought, hey, like there's no group for us to, get together and share the challenges, support each other, see how we can get things moving. How about we just start this thing? A group where we can just chat and just, essentially have a shoulder to cry on that understands what you're going through. So that was the original purpose. So there was only 8 people, I think, initially. And that's how it started. And so it just kind of grew from there. And so I kept a newsletter. So back then I was doing like monthly newsletters, used to do events. This was back in 2016. So newsletters, events. I was actively kind of recruiting people in that were working on digital health, building startups, stuff like that. So slowly but surely it grew. And I'd say after sort of the second or third year, I probably stopped investing as much in it because I just didn't have the time. So I stopped the newsletters. Used to write a lot of content. The website is, is now down, but the group has lived on, at least via WhatsApp and a few meetups here and there. So there's over 300 people in it. What I do now is I do an annual review. So this year will be my 7th year doing an annual review. I just haven't had the time or energy to write it.
The group, Digital Health Nigeria, was this before? Because you also started a company, Wella Health, right?
That's right, yeah.
Was this before Wella Health?
So it was around the same time. Oh. So it was all the challenges I was experiencing doing Wella Health that encouraged me to start this group, to find a community around it, yeah.
I'll be honest, though. I think it's one thing to be a doctor. It's one thing to, be in medicine. But I think it's something completely different to go jump into those waters and start your own, company. I feel as if, especially to do that in Nigeria where resources aren't as accessible, I feel like that takes a lot of faith for one. And it takes a lot of courage to actually jump into those waters. What prompted you to go ahead and just jump off the deep end per se, especially in a digital health where you didn't really have any forerunners, you look, I don't know, outside looking in, you would have to jump into that and figure it out, so where did that grit come from? Where did that desire to do such a thing come from? I know you mentioned helping your mom and it would have been easy to help other people, but like I said, I think starting a company is that's the deep end of the pool,
Definitely. So there's a popular meme that says, we didn't do entrepreneurship because it's easy. We did it because we thought it'd be easy. I'd say there's a measure of, no, exactly.
You don't know.
There's a measure of naivety in all of this. That over time you kind of figure that, oh geez, if you'd known what you know now, you probably wouldn't do it. So I think for me, so when I figured out that technology was the way to go for healthcare, I actually didn't fancy myself an entrepreneur. What I was gonna do was I was gonna invest actually. So, like I said, my track was I was gonna be a internal medicine doctor. Then I'd probably go do healthcare management and/or public health, and then make loads of money and be happy and be stable. But then when I kind of started to get interested in the space, I started to talk to people in Nigeria because I wanted it to be in Nigeria for sure. Because obviously for my folks, and people that were like me or are like me, that didn't have the services, that's where I wanted to be. And so I started to talk to a couple of entrepreneurs at the time. And I remember speaking to 2 people with the view to invest and support them. And I remember thinking, I don't feel very confident giving these guys my money.
Okay.
And I'm like,
wait, why didn't you feel confident?
Dude, man, you just know within the first 10 minutes that this
is they're up to something.
Yeah, they didn't get it. Do you get what I mean? Again, back then I was still I didn't get it either because 10 years almost down the line now, I see the errors that I made. But even then, as naive and as green as I was, I still could tell that these guys didn't get it because, first of all, they were not healthcare people. They were the 2 guys I spoke to were technologists, were tech people. you know? And so I figured, well, if this is important, and it is, somebody needs to do it right. These guys aren't. And I feel like I've got some insights and I've got the desire, then, why not me, And so that was my thought process. And so I thought rather than, put this money into them, I'll take the money and I'll just start it myself. And I didn't think I'd do it full time.
Bet on yourself.
Yeah, but I actually didn't think I'd do it full time, as a matter of fact. I thought I'd, kind of lead it, find the right people, hire them, and then let them run it. So I tried that model. It didn't work very well. And so it came to there was like a crossroads for me, because I was really into what I was doing. That was in a way that was affecting my day-to-day job as a doctor. Like I was really into, figuring out the business side, building a company, building tech. Like I was really into it. I'd go into work in the morning and I'd be trying to get away from patients to go like sit in front of my computer. And I knew this was dangerous for the patients.
Before you got prescribed there.
So that was my cue. I was like, okay, it's time to go do this full time, because I've gotta give it my all and do my best. And if it doesn't work out, fine, but I can't be like in between two worlds,
So how easy was it? Well, I don't think this was easy at all, quite honestly, but what were some challenges in finding the right team to, help you build Wella Health?
It was very difficult. So, I mean, my first team, for instance, totally got rid of all of them because it just didn't work out. They didn't understand. I didn't understand. I didn't know how to work with them. First of all, they were like my friends. And, one advice I give to people starting out is don't hire your friends, because it's very difficult to fire them. And you need to be able to fire people when you hire them. Don't hire family either, because again, very difficult to fire them. So, I mean, there are exceptions, of course, all the time, but I find that especially in Nigeria, it's important to be able to fire people because performance can be a challenge. So that was my first error. Is like I got in bed with people that were friends, of course, but didn't really see the vision, didn't have the right passion, didn't have the right skills even to do a startup. So when that didn't go very well, I got rid of that team. Then I returned fully. Having said that, actually, there was an Aussie friend of mine, really good friend. He was a great tech guy. So he built, first version of all of our software. It was excellent. So he was great to work with, but he was in Australia, and then he got busier with his life, so he had to kind of move on. But he helped me then. So when I moved back to Nigeria, and I kind of had to start afresh, he helped me hire a local guy that's now like our engineering lead and has been excellent since. So that was helpful. He helped hire that guy. And then I essentially just kind of, interviewed people, met people, worked with them on a consulting style basis. If they did well, then I'd bring them on more full time. So yeah, it's tough, but, you got to kiss a lot of frogs before you find the right people.
And so Wella Health, I'm familiar with, because it's healthcare financing, right? And health insurance. So I'm in the health insurance space here in Houston, but I'm curious for the audience who may not be fully familiar with Wella Health. Do you mind like sharing like exactly what Wella Health is and maybe what the financing structure looks like?
Yeah.
But before you do that, do you mind just giving us a brief overview from your perspective, the finance, like that environment without like, your company? And like just the climate of health insurance in Nigeria, period.
Yeah, sure. I mean, it's still with
like what would it look like without Wella Health?
Yeah, I mean, it's still without Wella Health because like we're nowhere near where we need to be. So again, for context, like we're tiny. We're very tiny compared to what the market is like and the opportunity. So if we zoom out and think of healthcare as a whole, so Nigeria, the last time we did a thing called a national health account, it's where, everybody kind of totals up what is spent in the country and sends it to the WHO. And then there's a national health account report. So the last time we did one was back in 2016. And then it said that Nigerians spend about 70% of the payment for healthcare is out of pocket by families, right? So for every dollar that's spent in Nigeria, 70 cents comes out of household pockets. Now, the challenge there, of course, is that absolute value-wise, that's about $7 billion, or at least it was back in 2016. The challenge with that is it's very fragmented and very unstructured. So $7 billion sounds like a lot, and it is a lot. But it is not $7 billion in one pocket or in one bank account. It is $7 billion divided by 100 million healthcare encounters every year.
Right.
Do you know what I mean? And so when you then, break it out like that, it's very inefficient, it's very fragmented, and the individual person that's bringing cash out of his pocket to pay for healthcare is buying, really substandard healthcare because the provider is not able to guarantee his cash flows. Because if you look at healthcare provision, about 60% is private, and even on the public side, you still have to pay fees, right? So there's fees across the board, full stop. There's only some free benefits, but you have to pay fees. So if I open an establishment that provides healthcare services, I cannot guarantee that anybody will come in the door and pay me anything. If I open an establishment in the US, what I've got to do is go talk to a couple of insurers, tell them here's what I do, sign a couple of contracts with Medicare or whatever, and I'm good, right? I could almost project for the next 5 years what I would do income-wise or cash-wise.
Okay.
And that enables me to sort of plan. I can go to my bank, I can go to my, equipment supplier. Like I could do a lot of different things that, makes my life easier as a, healthcare business in the US. In Nigeria, it's all vibes and inshallah, as we say. There is no guarantee of nothing. There is no guarantee of nothing. So because of that, the moment somebody presents, the chances you'll see them again is very slim. So you want to maximize that in that encounter every single time. So you're going to charge him the most you can get away with charging, and you're going to treat him with the level of quality you can get away with treating him at the price you're charging. Do you get what I mean? So there's some perverse incentives there then when you have people paying out of pocket. It's like the provider is going to charge as much as he can, and it's not going to give you great quality, because ultimately, like, what are you going to do? You're not going to come again. Well, you were not going to come again anyway. So the healthcare is expensive, it's very fragmented, and the incentives are all skewed. Now there is some health insurance, but it's only about 3% of people that have health insurance, and it's only really the formal market. So that's formal employers, employers with formal employees, providing them with health insurance. So it's actually mandated. The law.
Why is that? Is that like a lack of knowledge or awareness about it, or is it more affordability?
So two things. I'll tell you about the structure of the market. So if you have more than 5 employees in Nigeria, the law states that you must provide them with health insurance.
Okay.
But who is enforcing that?
That's a good question.
How do you enforce that? Nobody's enforcing
That's
it
even better
because it's very difficult to enforce. So the only companies you can really enforce it are the large companies, right? Who have to do all this reporting and all this, so there you could potentially enforce it. But there, because of the way they're structured, healthcare benefits are a perk anyway that you have to offer to your employees. So if you're like a multinational, you're an oil and gas company, you're a telco, you're a bank, of course you're going to give your employees health insurance. Like what kind of company wouldn't? So those are the formal employees that just get, insurance. Now, the other challenge is Nigeria doesn't have that many formal employers, right? Most of Nigeria's labor force businesses are informal. They are small micro businesses, 1-man business, 2 people, 3 people. If there are more people, it's not very structured. They may not even be registered. So you have about 60% of the economy is informal. And so, where do you even start to try to get people to pay for insurance? Now, the insurance companies themselves, they're structured for the formal guys, and the informal guys is a very different kettle of fish. So they just stick to the formal guys, build the companies, the, big premiums, and then they kind of, try to figure out healthcare based off of that. The challenge then is, the vast majority of the people who are informal workers then don't get any health insurance.
So the health insurance that the 40%, because 60% are informal, right? 60% of workers in Nigeria. So the other 40%, let's say, are formal. Who is funding this? Is this the government? Is this the employer? Like, is it a public-private partnership? What does that look like?
Yeah, so good question. So the people in formal employment, so the government workers, they do have a mandatory deduction from your salaries for health insurance. So that's the National Health Insurance Scheme. So that happens. So if you're a federal government worker, you're a state government worker, you usually actually have health insurance. It may not be of great quality, but you have it on paper. So that goes in, and there's a lot of accountability issues and, to be honest, fraud around that. And then the formal guys, so the private sector, that they pay in as well. So that's the insured market as it stands today.
Okay.
But a lot of formal employers, like you probably figured out, don't actually provide insurance.
Okay.
Yeah.
So where does Wella Health come in to play?
Yeah, so that is the problem space we're in. So our position is there's low insurance uptake, and that's not for a want of health insurance companies. There's 60 of them in Nigeria, right? That's more than enough. That's more than the number of banks we have. Some people argue that's actually part of the problem. Conversation for another day. But there's 60 health insurance companies who are focused on a small part of the market, like the formal market. And the challenge for them is they would like to do the informal market, but the way they are structured is very much catered to the formal guys, you know. And part of the reason for that is the premiums are certain, they're guaranteed almost. Like the company will pay you for 100 people, say 60,000 naira for 100 people a year, you know, like that adds up. And what you then do is you build a service to cater for that. Now, if you're going to go to the informal guys, they often don't have that kind of, you know, disposable income. If they do, they may want to pay every month. They're a little bit, you know, less sticky. They might pay this month, might pay the next month. And again, you know, they're not going to pay that much. And so the traditional insurers are like, you know, we don't really want to bother with this market. And so they leave it. And part of the reason is back to the healthcare provider. Is the healthcare providers are so fragmented, using of manual methods, that the insurers trying to work with them is so expensive and so cumbersome. That honestly, like, they're fine with their sort of 200, 300,000, 400,000 customers. The moment you put 1 million people, 2 million people through that system, it breaks.
And so this is in the sense of like electronic, like digital records, things like that.
Yeah, everything. So digital records, payments, claims, you know, quality of service. Like, because think about it, like if you have 100,000 people on your books, you'll see maybe 10% of that going through a healthcare service every month, so 10,000 people. Like, you can manage that on Excel. You know what I mean? Like Excel, you know, can take 10,000 rows, but 10x that, I mean, Excel will struggle. So, you know, you need the right systems, you need the right APIs, you need the right setup, all of that stuff. So, it can get fairly challenging with the existing system. So that's what we try to do, is we try to automate the systems around helping the insurers manage care so that we can then reduce the prices of premium. So our premium starts at, you know, about 400 to 500 naira a month. That's less than $1 a month. And then we just cover common conditions, and we also cover common conditions in the community. So rather than going to clinics and hospitals, we use community pharmacies, we use telemedicine, we use labs. So we can reduce the cost of care, reduce the cost of premiums, and we can kind of automate and scale a lot of the interactions.
So you help these insurers just pretty much just automate their systems to better, you know, provide health insurance to the unprofessional market out there.
Exactly. Yeah.
Okay. What are some challenges that you have seen with that? I mean, I'm assuming that you guys aren't working with the Excel sheets. You know what I'm saying? So it's like, what?
Dude,
like,
man, you'd be surprised. Like, people love Excel.
Actually,
they love Excel here.
Yeah, people love Excel.
I wish I could love Excel like that.
So yeah, I mean, we build all this fancy tech, and people are like, listen, man, just take my Excel spreadsheets. And even those are the good ones. Some people are like, listen, man, just take this WhatsApp message, you know, that's what I'm doing, or take this email, you know. So change is slow, change is difficult, and I mean, change in healthcare is even more difficult. So we found that building relationships are key. When people realize that you're in it for the long haul, you're their partner, you're not there to kind of judge them, you're there to understand their pain points, you're there to help them and kind of, you know, help with the behavior change slowly. and people start to switch. So, we started off with just a handful of patients here and there, but now we're seeing like 12,000 patients every month, and that's growing consistently. So yeah, it's every like literally everything has been a challenge. Everything, like nothing has been easy. But I think that we've proven that, we're really passionate and we're going to be there for the long term, and people are starting to trust us a lot more.
I know something I'm curious about, which I'd like to get your thoughts on. So, in the healthcare space in the US, right? I feel like there's a move towards, because you have your insurance companies and then you have your provider groups, right? Your doctors, your nurses. And I feel like over the past few years, there's been a move to almost a provider model, whereas like you have your payer, your insurance companies, almost own the provider groups or the physician groups, and then basically passing down financial risk, right? And so, is that something that you see happening in Nigeria, or is it something that is feasible? Because people would make the argument that it helps reduce costs when you have insurance companies and doctors under the same umbrella working to provide care. It makes it more efficient. But is that something you see happening in Nigeria, or is like, what does that look like from your perspective?
Yeah, definitely. I mean, I think it's great. It's a cost problem, right? I mean, the US as a percentage of GDP is spending crazy amounts on healthcare. And so it makes sense that they'll do that. And I think, it does make a lot of sense to have that. But I think the challenge, and maybe the US isn't, well, not maybe, the US isn't a great model, is there's an element of kind of the social and public good with healthcare, right? And having that outlook around what is beneficial for a larger group in a way that we can implement it such that individuals are happy with it, even though it may be to their detriment. So I think that, and I mean, Nigeria is very, let me choose my words wisely here. We like to think we're socialist. And I think especially with healthcare, most Nigerians feel healthcare should be free. And so with that model, and that is actually where the law is going, where it's mandated everybody to have a state scheme. So actually the insurance law in Nigeria mandates everybody to have a state health plan.
Okay.
But
as a state health plan, that's like the health plan. Sorry, the state is providing healthcare as opposed to the national.
No. The state health plan, but doesn't necessarily mean the state is providing the care. So the way the law is structured today, it says you must have a state health plan, which is there's 36 states in Nigeria and the FCT that all have health insurance agencies or schemes. Okay. So everybody's meant to buy a scheme from these agencies. Now, if you're indigent or you're vulnerable or you don't have the income, the state is actually meant to pay for you. But if you do have the income, then you're meant to pay for yourself. And when you pay it, it goes into this pool, and then you.
But how do you judge? Like, what? How do you know? Okay, this person like qualifies for this. Like, what are some of the criteria? Is there a financial threshold?
My brother, I've been asking this same question too. Nobody wants to answer. They say you're asking too many questions. So guys, walking, don't ask me a lot of questions.
We need to find out.
Yeah. So the truth is the criteria is not clear and transparent, and that is unfortunate. Because you know what happens when things aren't clear and transparent. So, but in any case, like the government cannot afford to pay for a lot of people. That's the truth. Yeah. It cannot even afford to pay for the amount of poor people that we have in the country. So it's only going to be a minimal, amount of people. But the idea is that, everybody gets a state scheme. The funds are pooled, and then the government can now pay providers depending on what they do. So there's two models. This is getting into some nitty-gritty and some detail. But primary care is meant to be capitated. What that means is that everybody is assigned to a primary healthcare center. And because your name is on the books of that primary healthcare center, the primary healthcare center will get a payment per month or per annum, regardless of whether you go there or not.
Yeah. Yeah.
Now, if you need to go into secondary care, so if you need to go into, say, general hospital, then every procedure, every encounter you have there, the secondary hospital is then paid a fee for that. So classical journey here is you have malaria, you go into a primary healthcare center, you don't pay anything. The primary healthcare center as well isn't paid anything because you went. They just have been paid, like every year they will get paid, regardless of whether you go or not. But if you say get sick, you get cerebral malaria, and then you need to go into an ICU in a general hospital, then the state health scheme will pay the general hospital for, say, 10,000 naira for the cost of, you staying in ICU. So that is the way it's structured at the moment.
Okay. And so is there, because it's interesting that you mentioned capitation, because that's the world I work in. Yeah. Like the capitation, all that, looking at capitation contracts. So when you're looking at incentives, right? Because you're paying the providers a set amount, regardless of whether or not the patients go. So when you're looking for incentives for providers to still be able to provide the same care, right? The same, or at least it's the same standard of care that they would, like, let's say, good standard of care. Is there a sense in which you are taking into account the risk, like how sick the patients are for the reimbursement, or is that just a flat fee that they get?
Yeah, so you're getting into the difficulty with the system. It's a flat fee, and I can tell you that it's a flat fee.
very, very flat. Very, very flat.
Very flat. So those guys are complaining, of course. They're like, this is ridiculous. Look at what you're giving me to manage somebody for a year for a host of conditions, because there's a host of conditions that the PHCs, the primary healthcare centers, are supposed to manage. So immediately it's not very sustainable, because the PHCs just don't have the resources to do it. And so there's another funding mechanism for PHCs to enable them do it. But you know how these things go, doesn't always work out. And then there's also the problem that the way the PHCs are structured today, they're not really like the best of places a lot of times to go get healthcare. Like I wouldn't want to go into a primary healthcare center, like I just wouldn't. They're not the cleanest, they're not the nicest, they're not the safest. And so for low-income people, of course, that works. I guess it works because they have no other options. But then if you're getting into like, middle class, upper middle class, you're taking this payment from them, remember, because it's mandatory, but yet you're giving them a location to attend where they're not comfortable going. So there's this mismatch of expectations.
Why is a company like this something that young adults within the diaspora would be like interested in? Or like, what would it look like for someone in the diaspora utilizing Wella Health? Because I know you mentioned like you have things planned for it later on down the road. Like, does that include like, bringing in people from the diaspora, people from like, the United States, people from like, Europe and people on all these other, places?
Yeah.
To even be involved in such a thing.
Yeah, no, absolutely. So with all the kind of expertise and experience, that we've had on the ground, and thinking back to my own initial experience, right, with helping my mom, I realized, and I was in the diaspora, I realized that actually there's lots of people in the diaspora that need that kind of experience and expertise from somebody like me on the ground. So if you're sitting in Houston and you've got, say, an uncle in Anambra who, suddenly becomes unwell, and, you're probably having to send money back for that, you also want to know, is he getting the right quality? Is there somebody I can talk to that gives me like an update? Like, how are things going? That's a real big problem. I've seen that problem myself. And so we built a product called HealthSend. Essentially, we do that, so we'll help you just manage the whole kind of payments and communication related to any illness for your folks in Nigeria. Classical example is, say you've got a mother with diabetes and you've got to buy her medications every month. We've got 2,000 pharmacies we work with across the country where we can just automate that process of your mother getting her medications every month. If they need a nursing visit, we can arrange that. If they need to go into hospital, we can have somebody going with them. Just gives you that kind of peace of mind, because I know lots of us in the diaspora, at least I know I felt this, feel very guilty, with family in Nigeria, that we're not able to be there to provide them with the kind of care and love that we would normally. So having, an outfit that is professional, do it on your behalf, is a great service.
Yeah, I personally resonate with that one. I wasn't born in Nigeria. I was born here in the United States in Houston. But majority of my family's back there. Like everybody on my dad's side is back there. And recently, this is kind of personal, but we've had some illnesses, in our family back there, and unfortunately we had someone pass. And I just can't help but think what would it have looked like if we were able to have more of a hand in providing him, with better health care, and I feel as if that's something that plagues a lot of Nigerian migrants,
Absolutely.
So,
and it makes a difference to have somebody there. So medicine in Nigeria is very paternalistic. And what that means essentially is you need a lot of advocacy. I need advocacy from knowledgeable people that understand the system. So, it's not just enough to sort of be on the phone asking questions. You need somebody that's going to go there, somebody that's going to make sure that things are being done, someone that's going to actually follow up. The amount of stories I've heard of people just passing away when, they could have been treated better if somebody was just there asking the right questions.
It's a difficult system. It is, because you're trying to navigate, because the infrastructure to an extent is not fully there to support the amount of people that actually need healthcare.
Exactly.
Right.
Yeah.
And so it's hard to really navigate that space. And so I'm glad that we have something like Wella Health that can actually, help be that bridge and that bridge that gap, basically.
Yeah.
We're coming up on time here, but before we let you go, we wanted to talk to you about African business heroes.
Yeah.
We wanted to talk to you about African business
Congrats.
heroes.
Thank you.
But yeah.
Still surreal. Can't believe I won it.
What was that experience like? What was the preparation, the presentation, and post? What was that like?
So it's one of those things where so the first edition, I know who won it. So Temi from Life Bank, you may have heard of her. Mm-hmm. So she won it. And so when she won it, I was like, okay, I should apply for this, and I think I have a shoe in. But I wanted to be ready. So I didn't apply until, we had a decent track record. So, Temi won it, I think, the first one, and I won the fifth one. So there was 4 years in between, where, again, one of my other friends, Sugar, he runs a lab, a network of labs and diagnostic centers in Nigeria. He was second place, I think, 2 years ago or 3 years ago. And, healthcare companies from Nigeria had kind of done well. And so I thought, okay, I'll chart, as it were. So I was like, okay, I'm confident enough I'll get into sort of the top 50, because the process is you apply on a digital platform. I knew I had decent revenue growth. So you need 3 years of audited financial statements. So I had decent revenue growth in 3 years. So I thought, I'll get into the top 50. And then from there, it's a coin toss. So I had a virtual interview and, got into the top 20. And so from there, it's who knows what will happen. So arrived, because there's an in-person pitch in Kigali for the top 20. And it's difficult because, I met the top 20 and all phenomenal entrepreneurs. Literally, there was a guy from South Africa that's doing $11 million in sales. I'm like, wow.
Wow.
No, seriously, impressive.
Also, sorry, I just realized we didn't describe. So what's Africa Business Heroes? What is it?
Okay, yeah.
Oh yeah. So
just so people know.
Yeah. No, so it's a big Africa-wide business competition sponsored by Jack Ma. So Jack Ma is the founder of Alibaba, massive big Chinese company. He's a billionaire. Mm-hmm. He came to Africa some 5-6 years ago, wanted to support African entrepreneurs. So he put, I think it's $100 million towards, discovering, I think, 1,000 entrepreneurs over 10 years via this competition and several other events. And so over the years, it's kind of gained more and more momentum, and it's quite a big deal in the kind of Africa business ecosystem.
Okay.
Yeah.
Okay.
So anyway, got to that.
Keep going.
Yeah, got to the semifinal. So 27,000 people applied. To give you context, 27,000 people.
Wow, 27,000.
Yeah. So got to that semi-final, great entrepreneurs, like I said, and I was like, wow, if I make it to the final, like I'm good. Because once you get into the final, you get like 100 grand. So it's like, okay, make it to the final, get 100K, and I'm good. So got into the final, I was like, wow, wonderful. I've got 100K, I'm a winner already.
So that one is good.
Yeah, exactly.
That was okay.
Yeah,
That was
so I'm
okay.
like, I'm a winner already, and when I went at the final, I was honestly, there was just a lot going on. Because I mean, like last year was a tough year for every business person in Africa. So it was a very difficult year. I was juggling so many things. And so by the time I got to the final, I honestly was not as prepared as the semi-final. So at the semi-final, because you're not sure, I tried to put my best foot forward, worked really hard on the pitch. And so that went decently. I thought I did pretty well at that. But for the final, I just, I was so busy, I didn't really actually have time to kind of craft the pitch, because it was going to be shorter and it was going to be even more significant, because it was a live judging panel, live audience, going to be streamed all over the world. Like, it was a bigger deal. And I just couldn't get myself to like prepare right for whatever reason. And so the day before, the guys, the judges from the semi-final, did a clinic. They said, if you want to talk about your presentation, come. So I put something together and I went to this guy. I pitched it to him and he's like, I saw your pitch in the semi-final. This is not as good. You got to fix it. So, he gave me some really good feedback actually. And so I ran back to the designer and I said, can you put this together with this feedback? And they did. And so I don't know what was going on, man. My overconfidence again. I didn't even go on stage like beforehand.
Yeah.
Because it was quite an impressive stage, right? Like there was VR, there was screens everywhere. And so the guys that were running the show said, oh, if you want to practice on the stage, come on beforehand. I was like, yeah, I've done lots of this before. I'm not even going to bother.
Oh, you were not anxious or anything. You were like...
No, I was just like, I don't know, my friend of mine at the time.
This one was doing cool guy.
Yeah.
This one was,
They don't know who I am.
But when I finally got on stage at the time, the lights alone are blinding, man. So I was first disoriented. Like that first, so if you watch the video, I was like stumbling a bit, Honestly, it wasn't one of my best pitches, I feel anyway. Can't even watch it back. But the lights, like the lights alone on your face, and I had makeup on as well,
Yeah.
So yeah, it was, and so I didn't feel my pitch was that strong actually, because I stumbled through some of it. Some people may not notice, but I noticed. I forgot some of my lines, and I was like, okay, I have my 100K at least.
Yeah.
What I thought I did decently was, because there's a Q&A, it's like a 30 minute Q&A. I thought I did that decently because I'm good at Q&As. It's just a thing. Because in medicine, when you train in medicine, our exams are essentially like verbal oral exams where like they just drill you for like an hour with questions. So you get very good at kind of answering stuff off the cuff. So I thought that I did decently at that, and that probably impressed them. And so then I watched everybody's pitches and it was excellent. Like everybody was amazing, and I thought to myself, geez, if I were to pick a top 3, I don't know if I'll be in it. And then on the judging panel, there were 3 people on the judging panel. 2 of them were women. And so the math in my head was like, there's going to be a woman in the final. Right?
Yeah.
The top 3. So the way it went is you had the top 10, they had the top 3 who would then go in to have like a round table discussion with the judges to pick a winner. And so I thought, how like you're trying to, figure out who's gonna, progress. Will I make it? Will I not? And I thought, what, there's gotta be a woman in the final because there's 2 men on the judging panel. There was one guy who I knew was gonna be there. He was doing like crazy amounts of stuff in like 20 African countries. He was making farming, like, it was just like this guy is there, So they were like creating their own like reinsurance company, had like billions of dollars. They work with like 20, like it was just like, I'm like, dude, man, calm down.
Relax. It's okay. Relax.
So he was there. Great guy though, Thomas, love him. So he was gonna make it, I thought. There was gonna be a woman. I didn't know which woman, and I couldn't place who the third person would be. So we went on stage. So they called the first guy who I didn't think would. I was like, okay, I didn't expect that, but okay, sure. Then they called the guy I thought would make it. So there's two guys. And I was like, okay, yeah, well, that's it for me. I'm not making it to this top 3. 100K, okay, happy days. I'm thinking of, okay, I'm going to fly back and figure out all this nonsense going on. And then they call me, and I was genuinely surprised. Like, I was genuinely shocked that I made it to that top 3. Because again, like I said, I thought there'd be a woman in it, and I was the last person they called. But then when I got to the top 3, again, don't want to toot my horn, but I'm great off the cuff. I just am. It's a skill that I have. Yeah. And this was going to be an off the cuff thing, and it was going to be some difficult questions, which again, I think
So let me ask you a question about that. So is that something you developed intentionally, or is that just how you've always been?
That's a good question. I don't think so. I'm a decent public speaker. I've always known I'm a decent public speaker. That's partly because I go to a church where you get to do a lot of public speaking right from when you're a kid. So when I was 8, for instance, I was already speaking in front of hundreds of people, like at 8, and I would do that consistently for like the rest of my life. So public speaking is not like a difficult thing for me. And as part of that, at church again, I do a lot of teaching. And again, it just kind of came naturally, being able to kind of answer stuff, facilitate stuff. So I think all that training at church probably just kind of prepared me for being able to speak in public and being able to kind of answer stuff off the cuff. So I think that's probably where some of that comes from. And I think there's some natural ability as well that I just have.
Okay.
And I've also tried to cultivate it, right? So I'll read stuff, I'll practice stuff, to try to improve as well. Because I think that it's worthwhile learning how to be a good public speaker, actually.
Because then you can get $100,000.
Well,
or even more.
Yeah, but then so then we're sitting in a round table, and they asked some very difficult questions, and I did decently at answering them, because I think the other two guys weren't as great off the cuff compared to me. And so, that's kind of stood out to them, and, I won. So it's 300,000 they gave. Yeah, but no, it was a great experience. It was a really great experience. I got to meet really great people. And I think the validation, so you do it, like, I've worked really hard at this for many years. Like, I'm not even kidding, I've worked very hard at this for many years, and like, it was nice to receive that validation and, to say, what, actually, we've done something valuable here that lots of people, see and recognize. So that was fulfilling for me. Yeah.
Dr. Neto, thank you very much for joining us for Noble Conversations today. I feel like we had a good time.
Yeah. This was really nice.
My pleasure. If you leave me, man, I can talk forever.
No, we can talk to you tomorrow. We can talk to you tomorrow. Actually, before we go, is there anything you would like our audience to know that maybe we haven't touched on, that we haven't asked?
No, I think we've touched on most things. HealthSend, I think the Diaspora facing product is, something we'd really love to get people testing, giving us feedback on. So HealthSend.Africa, check it out, give me some feedback, and would love to serve more people in diaspora and help their families back home get access to it.